We are living in a world which is still healing from the gloom of COVID-19 outbreak. Hence, even a faint resemblance to COVID feels like an alarming threat. So it's no surprise that this 20 years old virus called Human Metapneumovirus, HMPV, which is spreading in China, has sparked global concerns of another pandemic in the making. To discuss this pathogen, I have with me Dr. Rajeev Jayadevan, who is co-chairman of National COVID Task Force of Indian Medical Association. He is also chairman of Research Cell at Kerala Wing of IMA. Thank you, Dr. Jayadevan, for joining us. I will start with a straightforward question. Is the world on the verge of another pandemic?
No, the world is not on the verge of another pandemic. As you said, in the wake of the COVID-19 pandemic, any news that suggests a large number of people are visiting hospitals, especially in another country, can trigger speculation. And this speculation can snowball into theories, conspiracy theories, panic. Sometimes there are several people who I know are quite anxious when they heard the news. Been receiving calls from both doctors as well as the general public saying what exactly is happening. So a lot of that has got to do with the social media sharing of news or information that is overtly alarmist in nature. So no, that we are not at the verge of another pandemic.
So, what do you read from the China scenario? I mean, how severe HMPV can be, as we know that Chinese government has released a certain statement saying that, it's a winter season and this keeps on happening around this time. So, what do you read from that? You understand that there is a trust deficit when we talk about China in terms of what happened before. What is your reading?
Well, if you look at the literature before the pandemic, this is what I tell my fellow colleagues as well. If you want to really see the status of the world, how it was before, look at the published literature before 2019. So if we look at the papers and reports from 2018 and earlier, it's easily, we can easily see that every winter, there's a surge of what's called respiratory infections. Now, what's respiratory infections? Basically, is cough, cold, fever, flu-like symptoms. Some people really get the flu. Very rarely, some people get if a very large number of people get a respiratory infection. Some of them, yes, they do turn ill. That is true. But this occurs every winter. And especially in China, you see China is located further north of our country. And the northern parts of that country, they get harsh winters. And during every winter, there is an overload of hospitals in that country. Now, I'll take you through a little bit of what the healthcare system in China is like. If you look at published reports, I'm talking about peer-reviewed papers from China, they tell us a couple of very interesting facts. The first is the general public, they prefer to go to a large hospital for even minor ailments. Remember, in a healthcare system, like in India, we have the primary health centers, the single person, the general practitioners who see off these people who have minor illnesses. And when there's a severe illness, these doctors or clinics, they send the patients to the tertiary or the large hospitals. Now, in China, there's a tendency among the public not to go to these single-man centers or smaller clinics. They feel more secure. They trust larger hospitals more. So imagine what would happen if a large number of people with a common cold rush into a tertiary hospital, which is geared to treat the most severe illnesses. You can't turn patients away. So, and then that adds to this problem or to this perception. The second trivia, which our viewers ought to understand, is again, every nation has their own healthcare culture. In China, there's a well-documented, published preference of parents to want IV drips for their children. Yes, even if it's a common cold, the parents will insist on getting an IV drip for their children. They feel secure, they feel safer, they feel better cared for when they get an IV drip. Now, you know how difficult setting up an IV drip is. You got to admit the patient, at least keep the patient on observation. You got to have your personnel, you got to have your staff, and some monitoring has to happen. So what could be tackled in, let's say, 5 or 10 minutes for a minor common cold, like a runny nose in our clinics in India, may take several hours to clear this patient in a very large hospital. Now you multiply that by the large numbers of people who are coming in. And doctors, I understand, they oblige, fearing that patient or the parents will get angry if they say, look, we don't want to give you an IV drip, they get upset. So they're afraid of upsetting their parents. All this is published information I'm giving you here. So when a random person walks into one of these casualties or these large hospitals to their outpatient clinics, they see a lot of people who are wearing masks, many of whom are hooked onto IV drips and sitting around, but otherwise fine. Remember, people who are hooked onto an IV drip tend to be pretty ill, right, back in India. But over there, you see children happily doing their homework connected to an IV drip. And that's an interesting observation. So all of this perception provides provocative visuals, which can, if twisted with a scary narrative, can really provide a very scary narrative. And that's really what's happening. And we had discussed that even in 2023 and also to an extent in 2020. You remember in China, they tackled the pandemic differently than India and the rest of the world. They had a prolonged, let's say, zero COVID policy, which means that everything was kept locked up and there was movements were restricted for a fair number of years. And in December of 2022, they opened up the country abruptly. We discussed that in our program here. And now what happened was a large number of people got ill as predicted because there was no infection for 2 years. And suddenly you open up everything and everybody gets ill at the same time, especially in winter. December is winter. So that occurred in 2022, again in 23, and now in 2024, this is winter. And this is what is happening in China. And we have we have good authorities from the Chinese authorities saying that the number of infections they are seeing is really not as much as it was last year. Remember, these infections, the human metapneumovirus, is a long word, I know, we'll call it HMPV. It's one of several common cold symptoms that our children get. And most
But the information that you gave on the Chinese healthcare system is very helpful because of those scary audio, video, visuals that have been floating all around the social media. This is a very important piece of information that the culture, healthcare culture in that country is much different from India. And generally, people visit big hospitals, tertiary care hospitals, even if they have a minor illness. Like we go to local doctors or small nursing homes, they go to the big hospitals immediately and they opt for IV drips for their children, even if that is not medically required. This gives a lot of relief, when we compare those visuals going around and believing that, oh no, another pandemic is coming. China is not telling us the truth. So, Dr. Jayadevan, as you already started talking about HMPV, it would be good if in case you can tell us some of the symptoms that HMPV causes. As we know that this was first detected in 2001, this is fairly, we must be knowing a lot of things about this virus by now.
Yeah, for our viewers, imagine a child growing up. When the baby is born, over the next 3 or 4 years, we all have seen children around us. We've been children ourselves. We've all picked up numerous bouts of common colds. In fact, sometimes it's hard to see a child without a runny nose, and that it is so common. And the vast majority of these are caused by harmless viruses. When I say harmless, I say viruses that don't kill. We have the rhinovirus, the adenovirus, we got the HMPV, the Human Metapneumovirus. It's such a long name. It's really not as scary as the name sounds. And then there are several other viruses. The influenza viruses also affect children. They cause more of a flu-like symptoms, which means they get muscle pain and body pains in addition to their fever. And others simply cause a runny nose. So if you take a list of these viruses, the respiratory syncytial virus, RSV, there's a bunch. If you imagine a basket of viruses that go around causing respiratory infections in children. And when children get sick from school, we adults also would pick up some of those common colds, don't we? So that also happens. So the adults also get infected. The problem comes when you have a child who's an asthmatic. Let's say a child has wheezing or has an airway problem, who has what's called hyperreactive airways, basically which means the child can go into wheezing pretty quickly. And a viral infection is a common trigger for a wheeze. So such children may need to be hospitalized when they get a viral infection, whether it is HMPV or RSV or whatever that is. Now, if you look at published data from India, from South Africa, and from other countries, they have looked at the HMPV viruses. It's there in every country. And there's a general observation that by the age of 3 or 4, most children would have had at least one bout of this infection. How do you know that? By testing antibodies, obviously. Now, the HMPV has more than one type of HMPV, which means that if you get infected once, you could still get infected again in the future, pretty much like COVID. And several of the other viruses have this issue. And there are some infections like measles. If you get it once, you will never get it again. All right. So that's a different kind of immune response. But for most of the respiratory common cold viruses, including influenza, yes, you can get infected by the same influenza virus twice in a year. So that is something we need to understand. So in short, HMPV is just a common cold virus that peaks in winter season. It's been documented in India. Our own All India Institute of Medical Science has put a paper out a few years ago on this. So it is not like a new virus. Many people think it is something new that happened. And there are social media posts that claim that it's a new virus. These are random people who are of no, let's say, official or professional background, making their own assumptions on social media. I also have to tell our viewers this. When we look at information from China, it's really difficult to get credible information. You need to know where to look. If you start looking at social media or YouTube for information on China, you're going to be hit with a lot of rogue channels that provide alarmist, wrong, fake information, which is maligning the Chinese government. I just want you to know that. It need not be
very
related.
information.
Yeah, it need not be health. It can be about economy. Every aspect of their country, they'll put negative news on it. There are several such channels, so be very careful whose information you follow. I would go with legit sources like the CDC. The China CDC has a website. The World Health Organization has a website. The authorities, the Chinese authorities are quoted on legitimate news sources. I would go with that. I would not go with a random YouTube channel or a WhatsApp forward to find out what is happening in China.
Right. So, Dr. Jayadevan, my last question to you, how you think that India should monitor this situation?
Yeah, winter affects, India is a very large country, and winter is not the same everywhere. I live in the south, where we have very mild winters, but up north, there are harsh winters. So clearly, the impact of respiratory infections, it varies in different parts of the world. And one other factor that affects India and China is the air pollution. See, air pollution can also impact respiratory illnesses. The combination of pollution and viruses is a bad thing in cold weather. And people who have asthma or underlying lung disease, for example, COPD, they need to be a little bit more careful. And also people who have compromised immune system. Say some people take medicines, right? Say, for example, someone received an organ transplant. They need to be on medicines that suppress their immune system. They can pick up infections, and these infections can turn severe on occasion. And people who have, like I said, COPD or other forms of severe diseases, yes, you want to keep them away. Someone who's old and frail, weak, yes, you want to keep them away from picking up an infection. But otherwise, India has already assessed the situation. We have made a response. It's in the papers. The Ministry of Health and Family Welfare, along with several government agencies, including the All India Institute of Medical Science, the doctors, the CDC from India, all of them have met up. They've assessed the situation. They've said quite clearly that this is not a cause for alarm. And I would say that what is happening right now in China is nothing more than a regular surge of what we call winter-related respiratory infections. There's no sign of any new virus. This is not a new COVID.
This is a relief. A lot of good information by Dr. Rajeev Jayadevan, which is actually backed by scientific evidence. Thank you so much, Dr. Jayadevan, for joining us. Thank you so much. Stay healthy.
Thank you.